Welcome to the special podcast. For today's topic is MBBS aspirants who are willing to study abroad for medicine. So here we have two main guests. One is Dr. Srinivas Rao. He's the CEO of Apollo MedSkills, and the other one is Mr. Ali. He's the managing director for Gvantage.
Hello, Sana. Thank you for inviting us for the information session on overseas medical education offered by Apollo MedSkills in collaboration with Zarmed University in Uzbekistan and Gvantage International. It's a great pleasure to be here today to discuss with you the medical education program that we are offering.
Hello, Sana. Hope you're doing well. Thank you for inviting us to this program. We would be sharing our views, which will be valuable for the audience and parents and students at large. Thank you for inviting us.
Can you please explain me about overseas MBBS education?
The Bachelor's in Medicine program, which is a dream of a lot of Indian students, they want to become doctor. There are few points that I think are very critical for the parents and students to know, that about 2.5 million, about 25 lakh students, they appear for the NEET exam last year. But fortunately or unfortunately, we have about 112,000 seats, including the government and private colleges together. We don't have more than 1,12,000, 1,20,000 seats. So those remaining 23 lakh odd students whose dream of becoming a doctor remains. So if you see the history of students going abroad in last 2 to 3 decades, every year the number of students who go abroad for pursuing the bachelor's in medicine is increasing every year. But the very critical thing that actually the parents and the students should know before choosing to pursue their bachelor's of medicine out of India, the first preferred choice is definitely they qualify and they get a seat in India. But for the students who make the majority of them, like out of 25 lakhs, almost 23 and a half, 24 lakh students, they don't get the seat. So to address this, most of the students, they go abroad. But before going abroad, it is very critical for the parents to choose the country which they are going. If you see the history of 30 years, 20-30 years, the most sought after destination was Ukraine, Russia. I mean, like if 100 students are going out of India to pursue their MBBS, you will see that most of the students, they were going to Ukraine or Russia. So why was that destination more prevalent is Ukraine and Russia, they have been very aggressive in reaching to the Indian communities. So that was a trend started by Ukraine and Russia. But there are some other countries, including China, Philippines, and some countries in like Georgia, Armenia, and some of them in Caribbean. So if you go to Caribbean, the program itself is very expensive. Students who won't get a seat, here in government colleges in India, they want to go for a management seat, it is costing them about 1.52 crore rupees. But if the choice is, if they have that budget, they can definitely go to Caribbean, US and UK or Europe. The next choice for most of the middle class students, middle class families who come from the background of middle class, they constitute the majority of those students who write this NEET exam. So for them, there has to be education that is affordable for them. So for the levels of affordability, Ukraine, Russia, Philippines, China, these were the destinations they were going to. But for the parents, it is very critical to know that not all these countries are within the norms of National Medical Commission. So previously it was Indian Medical Council, now it is National Medical Commission, NMC, that actually makes the framework for regulating the whole medical education system. So students who want to go abroad, they have to see the guidelines of National Medical Commission. As per the National Medical Commission's guidelines, any bachelor's program in medicine has to be 4.5 years of academics and 1 year of internship, clinical internship. So some of the countries, like I believe Philippines, they have not, given the internship in their country. So if the students, they have gone through their academics for 4.5 5 years, but if they don't have the clinical internship there, National Medical Commission, Government of India will not valid that certificate.
Okay.
So before the parents or the students want to take a decision in choosing the country, they should know what are the guidelines of National Medical Commission, number one. Number two, if you see the medium of instruction in India, especially for bachelors in medicine, the medium of instruction which is prevalent in India is the most common is English medium. But in China or Ukraine, Russia, in these countries, if you go, more or less their English is not up to the mark. So Indian students, for them to understand their lessons, they need to have, if not native speakers, at least the kind of English language they have to have should be at par with the Indian standards. What we have observed, we have done a survey for more than 2.5 years, visiting more than 13 countries, and this research was done basically to know where are the pain points in the education program, in the bachelor's program. What we found is, number one, we wanted to check if they are all compatible with the guidelines of National Medical Commission. So some of the countries don't qualify for NMC's norms and guidelines. They don't fall in that guidelines of NMC. Number two, what we have found is most of these countries, they are having professors who are from the same country. Like for example in Russia or Ukraine, and some countries recently, government of Uzbekistan, they have privatized the licensing for offering medical education in 2022. So yeah, it's very recent that they started giving licenses to private colleges, while the government colleges are there since the USSR era. It was the Uzbekistan, Kazakhstan, Kyrgyzstan, these all countries, they were under USSR, Union of Soviet Socialistic Republic. After the split of USSR, several countries came out, they become independent countries, they got independence in 90s actually. But the colleges, medical colleges and universities existed since the era of Soviet Union. But they were all government colleges. Now in 2022, they started giving licenses in Uzbekistan for offering medical education. But the problem, major problem, as I have told you, the whole USSR, all the Central Asian countries, their medium of instruction is Russian. Or, for example, in Uzbekistan, the local language Uzbek is more prevalent. Like their primary education, secondary education, higher education, even their graduation, it is in Uzbek language. So, any of these Central Asian countries, they have a dominance of Russian language primarily and local languages. So, the professors who will teach in those universities are not native English speakers. The first point what I told you is the guidelines of National Medical Commission. Second point is the language of the professors. Third, the curriculum what you see in India is one of the best in the world. The doctors from India, you can see a lot of professional doctors like Dr. Srinivas, they make marks while they go to Europe or US. So that is one more criticality where they have to make sure that the curriculum, the syllabus has to be at par with National Medical Commission's guidelines. So these are the few things that the parents has to see while they choose MBBS abroad program.
Dr. Srinivas, could you please explain about Apollo MedSkills and elaborate its significant contributions in terms of medical education?
So first I'll take an opportunity to give a brief about Apollo's involvement in this medical education program. So Apollo as a group, we are the leaders in healthcare. So we are diversified into multiple segments. Most of them know Apollo as a hospital group and a chain of pharmacies, chain of diagnostic centers, clinics, right? But Apollo is also into education. So we call it as Apollo Knowledge. We have an Apollo University, we have medical schools in India and in UK, we have nursing institutions, we have physiotherapy colleges, healthcare management institutions, and we are also the largest skill development company. So Apollo MedSkills has partnered with Zarmed University and Gvantage with a strong purpose in transforming the medical education, particularly for the overseas MBBS programs. So coming straight to your question on why Apollo MedSkills got involved in this partnership. So basically when we are looking at the problem areas in medical education, one of the significant problems that we have identified in the last 1 decade is definitely, as Mr. Ali had just mentioned, that there is a huge disproportionate gap between the number of aspirants who are actually aspiring to become doctors by writing the NEET examinations. It's 2.5 million, 25 lakh students are writing, and only there are close to 118,000 medical seats now, and about 1.3 million, 13 lakh students are qualifying in the exam. So there are significant number of students who are traveling abroad, the students who have a strong aspiration but unfortunately couldn't get through the interviews here and are unable to get through the medical schools. They are going abroad. But if you look at these students who are actually returning back, only 8% of these students who are actually returning back to India are clearing the clinical licensing exam in India. It's mandatory to get registered in India to practice medicine, and for that registration you have to clear a exit exam, which was called FMGE, Foreign Medical Graduate Exam, and now it is called NEXT. So unfortunately most of the students are not clearing it. When we deep dive why the students are not able to clear this exam, we have identified 3 or 4 reasons why the students are unable to clear this FMGE exam. One, there was a mismatch between the curricula which is taught in these overseas MBBS programs and curricula that India teaches. Though there are similarities also, but the gap has been wide, the difference gap is very wide. So what we did is, the first step as part of the academic partnership, we looked into the curriculum, we deep dived into the curriculum, found the gap areas. So we worked closely with the professors from the Zarmed University and professors from Apollo. We jointly worked and chalked out a curriculum which is closely aligned with the NMC's curriculum in India. So this is the first step, because when they study in a similar mode, then their chances of clearing the Indian licensing exams will be high. So this is the first thing that we did. This is the first gap. The second gap that we have identified is the medium of instructions, which Mr. Gazanfar has already mentioned, that the medium of instruction, there is a challenge of language. Okay, so how are we addressing that? We are addressing the challenge of language and also academic excellence by sending Indian professors who are trained with us to Uzbekistan, into Zarmed University.
Even Indian professors from India, you're taking it to Uzbekistan, sir?
Yes, this is one of the significant USPs or unique selling point for this program. No other university who is running an overseas medical program is deploying a full-time professor or faculty on the ground of these foreign soils. So we are the first ones to do this particular thing. So this is addressing 2 issues. One, the language barrier. The second issue is the academic quality. These 2 are improved. Okay, so this is the second thing. The first C that we have addressed is the curriculum. The second C that we have addressed is the clinical excellence and the clinical delivery. And the third C that we have closely looked at, how we can transform medical education, is the clinical exposure in the hospitals. So fortunately, when Mr. Ali has actually invited us to Uzbekistan to visit the campuses there, we have seen multiple campuses there, And Zarmed is one of the campuses that we felt that it has got a world-class infrastructure. It has got necessary requisite infrastructure to train the students, labs. They have simulation labs. And generally in these countries, cadaveric dissection is not allowed. Cadaveric means a human body dissection is not allowed. But they have a very fantastic alternative, which is digital dissection boards, which is very close to, and you know, all the new generation students are tech savvy. They can easily get used to UIs of these digital dissections. So the infrastructure is great. So the campus is great, which is a third C with the relevant infrastructure. The fourth C, which is another big USP that we are bringing in, is integrating clinical career pathways to the medical education. When I say clinical career pathways, when a student does medicine, medicine is such a beautiful degree. It gives the doctors flexibility to work anywhere in the world, and whole world is short of doctors. So today, the students who are actually studying with Apollo MedSkills Zarmed University in Uzbekistan, they will have an opportunity to work in US if they are clearing United States medical licensing exam. They will have an opportunity to work in UK if they are clearing the UK MLA exam, United Kingdom Medical Licensing Exam, currently called as PLAB. And they can also clear the Middle East licensing exams like Dubai Health Authority exam and work in the Middle East. But if they wish to come back to India, they can clear FMGE and look for a vertical career pathways from there. So this program has an integrated clinical career pathways to this education. So these are few of them academically, the way we are transforming the medical education, but non-academically also there are multiple areas which are challenges currently the students are facing. I would actually request Mr. Ali to just explain what are the couple of non-academic activities like food, accommodation, which are very critical to hold the student and to hold the attention in his academics.
No, not just the food and accommodation, there are a lot of other aspects that actually make this program a comprehensive package, which undoubtedly will be the best program that we can offer for Indian students, especially who are dreaming to become doctors abroad. So we have the academic excellence is the industry leader, Apollo is already there. And as far as my company, G-Vantage is there, we are the first one to bring in all the international brands to Uzbekistan and Central Asia. My company is authorized partner for Microsoft, Apple, Adobe, Autodesk, Cisco, Meta, PMI. All these training and certifications are done by our company in Uzbekistan. So most of the universities have adopted to such programs, and some of the certifications have been approved by the government and subsidized programs. So we basically wanted to, this is definitely related to academics, but not the core academics part, like it's not about biochemistry, physiology and general medicine. I'm talking about the other aspects of the whole educational ecosystem. Like we found most of the universities and colleges in India, they are up to the mark and up to date in technologies like automation. IT automation is one very critical point, like having the students with e-books and tablets with their course, interactive lessons. Apollo has already integrated one such program. They have got pads which has the whole interactive lessons, video lessons and lectures from professors of AIMS and different medical colleges. There are some of the lecturers from AIMS and very renowned colleges and universities of India. So that is the innovation that Apollo is bringing in for the educational transformation. G-Vantage is implementing the learning management system. Most of the parents here are worried, how is our child, is he eating properly, is the accommodation secure, and how is the environment there, is he getting into some extracurricular activities or not. So for all these we have implemented the education management system. It is called EMS. So the education management system will keep the parent updated for every activity of the child. They will be having the access to the attendance of the student, his assignments, tests. So we have done the whole IT automation for delivering the academic excellence.
Even in India also will not get this type of
There,
requirement. and
there
all.
are a lot of schools,
but
most of them.
not this much high-end version. We don't have
So
that.
we are giving them ID cards which are embedded with chips that will actually give them the classroom access, and the moment the student crosses into the campus, his attendance will be logged in. So the attendance management system, his assignments, project management system, all inclusive is the education management system, which is called EMS. And we also have a LMS, learning management system, and Apollo has integrated that part. So this is one part. Other than this, what we have found specially, as I have told you that we have done rigorous research there. Most of the Indian students, for them having Indian food is very critical.
Even in India also we are not getting proper authentic food.
Correct.
Even I studied in one of the Odia college, but we don't get South Indian meal. It's
Yes,
great.
like for example, students from South India, they go to North or East, they don't get their food. So what we did is we called for almost top 10 catering companies in our state, and they also do catering for a large corporate things. So we have got caterers from India who will be taking the Indian chefs from across the country. Like somebody wants a Gujarati food, he has that. Somebody who is from Bengal, somebody who is from Tamil Nadu. So we have got chefs that will be Indian. Even if you have Indian chefs, you won't find the Indian spices there. I mean, like just for example, you see the red chili powder there. You can literally eat it. It is very colorful, but it is not spicy. So we are taking the spices from here. We are taking the chefs from here. And one of the most concerns what most of the parents have is they are sending their. See, you have to remember, students who are going for MBBS, they are not elderly children. They are in their teenage still. So parents are concerned about their security and comfort.
Mainly
when
for
they go.
girls.
Yeah, for girls, the safety. So what we have done is we have separate accommodation for girls. The girls hostel is different and a separate boys hostel. And we have appointed wardens who are Indians.
Wardens are also from India.
Yes, not only the professors will teach, when they go back to their accommodation, we have couples taken from here, Indian husbands and wives. Those couples will be, rendering their services as
I
wardens.
think so. It'll no more Uzbekistan college. They can feel like Indian college only.
Yes, they will definitely have a home away from home. We are creating a small India there. So the whole campus, the hostel, the facilities, and the academics are definitely by Apollo. So Indian food, Indian lecturers, and Indian curriculum under the guidelines of NMC closer to it. And we have made sure that it becomes a hassle-free journey for the students who dream to become a doctor. Right from their visa application to the application for the admission to getting their visas, helping them with travel itineraries, receiving them at the airport in Uzbekistan, escorting them to the college campus, getting their medical done, getting their registrations with the local police and immigration. So all these processes are seamlessly done by Gvantage, including the food and accommodation from Indian chefs and Indian spices.
So just to add to what Mr. Ali has mentioned, to sum up in a word, with respect to medical education, India's is one of the top countries for medical education. So what I would like to say is, while we talk about getting global class to India on multiple occasions and multiple fronts, we can proudly say that we are taking India class medical education to the world. So we are actually taking an India class medical education to the world. That's what is happening in this partnership.
Dr. Srinivas, yeah, can you please explain me as being a doctor, how Apollo MedSkills are delivering the medical education in Zarmed University?
It's a very good question, Sana. In fact, most of the parents would be thinking of how the academics is delivered in medicine. So generally, the medical education, the pattern of delivery is similar across the globe. When I say across the globe, the medical education, MBBS education, the way it is delivered in India is similar to the way it is delivered in UK, way it is delivered in US, in Uzbekistan, Russia, Kazakhstan, wherever they study, the pattern is similar. I'll explain the pattern and I will also say how we are going to be different in that pattern. When you see the medical education is delivered in 4 structured pathways. The first pathway is the basic medical sciences. The basic medical sciences means the basics of medicine. This has 3 subjects: anatomy, physiology and biochemistry. Anatomy means structure of the human body. So in anatomy we teach what is the structure of the brain, what is the structure of the heart, how many chambers it has, what is the structure of your lower limb, upper limb. So every structure is taught. That's the reason the students dissect a human body, because they will go deep inside the heart, they go deep inside the lungs, they check the liver, how it is, they check kidneys, the position of the kidneys and how they look like. It is only a structure. The second subject that we teach is physiology. Physiology is the function of the human body, like how heart beats, how heart pumps the blood out of the to the entire human body, how eyes recognize the light, how eyes recognize the color, right? Similarly, how you're breathing and how the lungs are sending oxygen across the human body. So this is the function of the human body, that is physiology. The third is biochemistry. Biochemistry is, bio is life and chemistry is the chemical reactions. So a human body has multiple chemical reactions happening inside it. Okay, there is something called Krebs cycle. You must have in biology, if you are a biology student, you would have heard about mitochondria and the function of various organelles, right? There are a lot of chemical reactions happening in the human body which is keeping us in a functioning in the right way. For example, if someone has got loose stools and vomitings, they lose salts. So some of them may get severe headache because there is a loss of sodium, chlorine, potassium in the brain, and brain is actually showing it as a symptom as headache. Or there can be a muscle cramp. They say, I have severe calf pain, I am unable to walk, there is severe weakness. So the chemical reactions are altered because of loss of salts. So this is just one example, but this is what is taught in biochemistry. What are the chemical reactions happening in the body? This whole 3 subjects are called basic medical sciences. So whether you learn medicine in US or whether you learn medicine in India or Uzbekistan, our nose is nose, eyes are eyes. So they are going to teach the same. So my nose is not different from the nose of an American citizen or a nose of a Russian, right? So it's very critical that everyone learns this, and this is the foundational subjects. So the foundations have to be strong. Then comes the preclinical sciences and paraclinical sciences. What are preclinical sciences? Pharmacology, microbiology. Pharmacology means what are the various medicines, what is the function of each medicine, how it is metabolized in the body, what is the half-life of that chemical. When you take a paracetamol, you say, doctor writes, you have to take 1 paracetamol every 8th hourly. Why 8th hourly? Why it not be 12th hourly? Because the paracetamol function will stop, the reaction of paracetamol will stop after 8 hours. So you have to take 2nd dose, you have to take 3rd dose. All of this is taught in pharmacology. In pharmacology, multiple things are taught. I am just giving a layman example for you to understand and for the parents to understand. So then we have microbiology. So you know various infectious diseases are caused by various organisms. We say that some diseases are bacterial diseases. There is a coronavirus causing viral diseases, dengue fever, viral disease. Okay, then there are multiple other microorganisms, fungi, which cause some diseases. You get skin infection, right? So, what are those organisms? How are they going to affect human body? What are the infections that may cause? And what are the useful bacteria? For there is a lactobacillus in gut. It is a useful bacteria. You have to learn. In microbiology, you will also learn about multiple organisms that may cause diseases in human beings, even the parasites. Okay, so parasites are mosquito biting you. It may cause malaria, it may cause dengue. All of these are taught in microbiology. And these are the preclinical sciences. Then you have paraclinical sciences, which are pathology, social and preventive medicine. Okay, then you have forensic medicine, where if there is an unnatural death, then you have to look at how the human body is aligned. Suppose if you take some poison, right? Someone got poison, there are some organs which get altered. Sometimes a metal poisoning will go and deposit in spleen. The doctors will open spleen, and if they find okay, then or liver, the mercury in the liver. So someone has done a slow mercury poisoning. That is taught in forensic medicine. Then as I told you, social and preventive medicine. When you go to the rural areas, it is very important to explain as a doctor the importance of sanitation, good air, use of toilets, why it is important, how to keep your environment clean, why you should not stagnate water, what will happen. This is all public health or social and preventive medicine. You will learn about creating awareness of disease, communicating it. It's called IEC, Information, Education, Communication. So this all is taught in the paraclinical sciences. Pathology is slicing the tissues and seeing a normal tissue and an abnormal tissue. Someone who has got a cancer, how the tissue looks like, some normal tissue, how does it look like. That is the reason biopsy goes to a pathologist who will read, right? Then comes the clinical sciences, where you study general medicine, general surgery, psychiatry, radiology, all subjects. So totally in Uzbekistan, in our syllabus, we have 51 subjects. So the students have to study 51 subjects. I gave few examples, right? They have to study by multiple methods. One, by working on a maybe cadaver, dead body, and seeing the tissues. By looking at some three-dimensional videos. By looking through the microscope certain microorganisms. By interacting with patients, understanding their emotions, understanding emotions of the patient attendants and how to address that, and then speaking directly to the patient, touching him, that's called palpating, inspecting him, inspection, palpation, percussion. Sometimes you have to percuss. For example, there is fluid in the abdomen. The doctor will put a hand and do this. So then we will get a different sound. All these things are taught in medicine. I know I have given a very elaborative answer, but this is how medicine is taught. Okay, and across the globe, medicine is taught in this way. India is unique because the amount of clinical exposure that we get in India, like you name a case, you see it in India. Suppose there is a case of, say, acute gastroenteritis, okay, or amoebiasis. A doctor studying in Switzerland, he will only read that in the textbook, but you will see 100 cases in a government hospital every day. So you will know how the patient is reacting with the disease, right? So that's the similar clinical exposure we also get in Uzbekistan, because they have their own hospital. And when the students come to India during their holidays, they will have an opportunity. They can actually register with us to have some observatory skills in our hospitals. So we have our hospitals and our own network hospitals also at Apollo MedSkills. We can actually put the students in clinical observership when they are here, okay, during their holidays.
That's a wonderful.
Absolutely, that will be a unique.
I don't think any student studying abroad in any part of the world will have this privilege of
having an observership.
It's impossible, yeah.
So this is how we deliver, and this is going to be one of the best overseas medical education programs that the students. I actually, I'm not selling this program, but I want the parents to think wisely, utilize this opportunity, and understand the complexity of medical education. And a person becoming doctor is actually impacting lives. Okay, so you cannot have a half-baked doctor. You cannot have a half-baked doctor, okay, because you are actually dealing with lives. So it's very, very critical decision. Aspiring to become a doctor is the first major step, but becoming the right doctor is the most critical step for the society. Aspiring to become a doctor is something that you owe for yourself, but becoming the right doctor is for the society and community at large. So it's a very important decision.
Doctor, I have a question. Can I ask?
Yes, yes, please.
In terms of clinical exposure, what you have told,
Yes.
generally students who are pursuing MBBS in different countries, are there diseases or conditions which are specific to that country? Like you told, it was a surprise for me. Like MBBS is not there in Switzerland, you mean?
Yeah, yeah.
So-
You rarely find a case of infectious diseases in these countries. For example, similarly, skin cancers, okay, are not prevalent in some countries at all. In some countries, they are very prevalent. Okay, diseases like Alzheimer's disease. When I was studying medicine, it was not very common in India. Today it is. Today it is quite common.
So there are diseases which are country specific also, regional.
Yeah, which
and-
are more prevalent in certain geographies
Okay.
and less prevalent in certain geographies. Infectious diseases, we being the tropical country, more exposure to kind of this thing, sun, we may be protected from certain diseases.
Correct. A very interesting point from this, what I remember, students who are going to certain countries like Georgia, I have seen, the the clinical exposure in those countries is way lesser than what you have in Uzbekistan because of the size of population.
Correct. That matters. Yeah.
This is what I will also agree. Why? Because one of my cousin went to US and she pursued her MBBS in US, but she doesn't have any clinical experience over there, and she came back to India, and she is unable to crack that FMG.
The FMG exam.
FMG should not pass. See, the basic thing what Dr. Srinivas has rightly pointed out is you can get the education in any university of any country. How Apollo MedSkills is bringing in the transformation is more important. How medical education has been, transformed in a right direction, specifically in the area of, as such, Apollo has medical colleges in India. One is in Chittoor and one is in Jubilee, Hyderabad. So though they have the core, Apollo MedSkills is trying to utilize their expertise and experience and transform the whole, offering of the medical excellence in Bachelors of Medicine, especially in our partnered medical colleges and universities. Like I told you, why we chose Uzbekistan was there was a recent report which I have shared with you. It's from Lloyd's. Lloyd's is an international group. Uzbekistan ranks among top 5 most safest countries for the citizens movement. So for the people, Uzbekistan is considered as, is listed as, by Lloyd's report, one of the safest countries in the world. It comes among the top 5. So the crime rate is not there. Plus the beautiful thing is you have got Lal Bahadur Shastri Road, Mahatma Gandhi Road, everything is there in Uzbekistan. Most of the parents are concerned about the safety, security, and life of the student is not just in the campus, no. Classrooms, academic excellence, clinical exposure. As he has told, the infrastructure of Zarmed University is one of the world class. 2, their libraries, classrooms, digital dissection boards, these are all world class. Another wonderful thing what they have is there is an Indian group of hospital called Pratiksha Hospitals. So Zarmed has started its own hospital, teaching hospital, in partnership with Pratiksha Hospitals of India. So Zarmed has, it can be called as one of the few universities in the whole Central Asian belt to own a private hospital for the students. So the students will get the clinical exposure, as Dr. Srinivas has rightly pointed out, that most of the students' quality of education is assessed by how much exposure he has to the clinical practice. In other countries, as I've told you, in Georgia, Armenia and all, the population is so less, there are no patients. So how can he actually have his clinical exposure? That is one point. Another beauty of Uzbekistan is about 180 plus days are sunny days there. Though they have extreme winter, I would definitely want the parents and the students to remember that they need to carry certain clothes in the winter season, which for almost 4 months. You will have snow and you will have very extremely low, temperatures there. So for that they need to take some precautions like have some inner wear and all. So it has got extreme winter and extreme summer also. But as far as the security outside the campus also, country in general, as I've told you that the reports of the most secured countries in the world, Uzbekistan has been considered as one of the most secured countries by Lloyd's International Register. So this is outside the campus also, the life is safe, and you have movie theaters, you have parks, amazing roads, buildings, infrastructure, entertainment is there, and most importantly, they have the Uzbek people have decades long of cultural and historical ties with India. As of now, the bilateral trade is also on a very good note, and India gets one of the top revenues from Central Asia for medical tourism. So a lot of patients from Central Asia, they come to India for medical requirements and treatments. But this transformation what Apollo MedSkills will be bringing in with the quality of education, I hope that will also contribute for most of the Uzbek people to have the treatment by Indian students who go there, become a doctor, register themselves. They can start their clinics, they can start their hospitals also. That's one. In simple, the country is safe and it is vibrant. You have many yoga centers there, and Indian cinema is, people are crazy about Indian cinema there. I have, me and doctor has had several times, we had food in Raj Kapoor restaurant there. So any Uzbek, if you see, generally when you go out in a foreign country, people, they don't speak your language, but you will be shocked to see that the moment they see an Indian student or Indian person, they'll say namaste. So that's how they greet, because they know that Indians, they are so close to the culture, and they'll tell you the names of Raj Kapoor, Mithun Chakrabarti, Salman Khan, Shah Rukh Khan. They'll tell all these names. They know, and all our programs with the Hindi soap operas, what you see in Zee TV, Saas Bhi Kabhi Bahuti, and all that, it is dubbed in Uzbek language, and they watch those Indian serials. So there are a lot of similarities in culture. They respect the culture. They respect and love Indian culture basically. And most of the Uzbek students, there are a lot of bands actually. They play Indian music.
Yeah,
they do Indian dances.
In fact, we were in one of a big event of Zarmed when we were there last time.
Yeah.
And after the event, obviously there was a cocktail and then there was music and dance. And most of the songs played were Bollywood songs.
Yeah,
and surprisingly, I saw a Telugu song of Pushpa also playing it during the event. So
they like Indian music, Indian culture, and the safety is zero crime rate. And you have entertainment there, recreation there. So safety in terms of student safety, for the citizens movement and entertainment, everything comes as a package, and Apollo is a cherry on the top. So we are making the complete package for students, Indian students, to have a home away from home, have Indian professors, aligned syllabus of NMC in foreign country, Indian food, Indian wardens, and a good cultured, safe country there for their education.
Then it's a single stop destination for MBBS aspirants.
Of course, it is a one-stop solution for aspirants who want to become a real doctor. As doctor has told, aspiring to become doctor is for your own self. But becoming a good doctor is for the society. So, I mean, like anybody who is planning or aspiring to become a doctor abroad with any MBBS abroad program, I think Apollo is the best answer for them.
Yeah, definitely.
So, thank you for inviting us. Any other questions, please?
So one more thing, like apart from education, like will they have CCA activities in their college?
Yes, we have a sports complex.
Okay.
We have indoor, outdoor games, and we have a lot of extracurricular activities like we have games and sports, we have essay writing, elocution competitions, and all the games which are here in India prevalent like cricket, football, and everything. We have all the grounds, we have the facilities, infrastructure, the whole sports complex is there. So the students can have extracurricular activities, and we conduct cultural programs also. Like we'll celebrate the Indian festivals like Deepavali, Dasera, Ramadan, and everything. So we celebrate the festivals. We have cultural programs. We have sports complex. So everything that you can expect, in a college for the overall student development, they are available there.
Sir, can you please say me that how affordable is this course in Uzbekistan for Zarmed University?
Well, with the name brand Apollo, I would say there will be no compromise in the quality of education.
Yes.
But definitely we have worked so hard to crunch the numbers, and we have made it the most affordable program ever. Like you have to understand one thing, if you hire a professor in those countries, you can easily get for a $600-800 a month. But the kind of professors Apollo MedSkills is selecting and training them are minimum, MBBS with MD or MS, with that kind of postgraduates. So with at least 2-3 years of experience, those kind of professors definitely they will not be coming for $600-800. They will definitely be at least 5 times more than that, because any professor from India who has got 2-3 years of 5 years of experience is easily drawing 2 to 3 lakh rupees here. But still, to make it affordable, we have taken every measure to make it possible in the affordable levels. We have kept it up around $3,500 as the academic fee, and I would like Dr. Srinivas to elaborate on why the pathways has to be, I mean, like why did we consider the pathways like UKMLA, USMLE, NEXT? We have our professors who will be taking the classes other than the academics for the MBBS. There will be pathways, like the student can choose between UKMLA, USMLE, and FMG. So how are we going to address that? And
So yes, the career pathways for the medical students should not end at an MBBS level. Okay, most of the students and most of the parents want their kids to become postgraduate doctors, and it is good. You can be a general practitioner and serve the community, but most of the students aspire to become consultants or postgraduate doctors. So to become a postgraduate, there are multiple pathways available across the globe for doctors. So one is they can do the MD MS program, which is a clinical specialty program in India. After clearing their foreign medical graduate exam entrance, they can get into MD MS in India, and they can go for a super specialty education, which is a DM. Okay, so that is one pathway. For that, they have to clear foreign medical graduate licensing exam or a next exam in India. The similar pathway in UK, they can take by writing an exam called PLAB, Professional Linguistic Board Examination, or they can take UKMLA, okay, which is United Kingdom Medical Licensing Assessment Exam. There are also other pathways of Royal Colleges. They can become member of Royal College of Physicians, member of Royal College of Surgeons, member of Royal College of Obstetrics and Gynecology by clearing those exams. So that's the UK pathway. The third pathway is to US. So some of the students may want to go and settle in US. So they have to write the equivalency exam or a license exam called USMLE, United States Medical Licensing Exam. And if they want to settle in the Middle East, every country has their own licensing exam, like Dubai Health Authority, Qatar has a Qatar Health Authority licensing exam, Bahrain has its own exam. So one common thing about all these exams, again as I told you, the medical education is delivered in a basic medical science, preclinical, paraclinical and clinical science, right? All these exams are very clinically oriented exams, okay? A question may come integrating all the subjects. When I say a question may come integrating all subjects, a question may come that a 60-year-old man has been losing weight for the last 6 months, and he also have ulcers, chronic ulcers in the mouth, okay, and there is a biopsy taken from his mouth, and the biopsy shows this picture in the pathology report. Okay, here you are covering clinical medicine in that question. Okay, you are covering pathology. Okay, you are covering that he has lost weight and function of the body. So all the subjects are integrated in that question. Most of the questions that come in these licensing exams are clinical reasoning questions. So the student should have an integrated knowledge from anatomy to medicine. So what happens is, when we are teaching anatomy, physiology, biochemistry, and when you are parallelly teaching FMG or parallelly teaching United Kingdom Medical Licensing Exam or USMLE, you have to teach clinical anatomy when you are teaching anatomy. Okay, when I am teaching anatomy, I have to teach clinical anatomy. What does it mean? When I am teaching anatomy of liver, I will also teach what is fatty liver. We will also teach what is cirrhosis of liver. When I am teaching anatomy in the first year. At the same time, when I am teaching surgery on how to do hepatectomy of surgery of a liver, we will also teach anatomy of liver. Because without knowing anatomy, you cannot do surgery, and without knowing that, the basic medical sciences, so foundational, so the questions come across the subject. So you should have a knowledge of, integrated knowledge of all subjects. That's the reason we start teaching the licensing exam coaching from year 1. Okay. You can't teach anatomy, physiology, biochemistry, and in 6th year, we will not ask them to reopen their books from year 1. They have to open their books for their lifelong.
But doctor, generally the students who are completing their courses abroad, what happens is they complete their exam, they take the degree, they come here, they join for a 1 year or 6 months of coaching for NEXT.
Yes.
So how different is our program, and I mean, like in what terms we are doing better than offering that 6th year?
As a medical doctor, forget about this partnership and how we are going. As a medical doctor, you can have a crash course for IIT. You can have a crash course for NEET. You cannot have a crash course for a medical licensing exam. What I mean is, you have to study from day 1 and you have to integrate that knowledge in the brain for lifelong. You cannot finish your medicine and go for a 2 months crash course, 3 months crash course to clear your licensing exam. Okay, that can be a refresher course, but it cannot be a crash course. There is a difference between a refresher and a crash. So what I mean by that is, they have to learn right from day 1, and they can go for a 2 or 3 months refresher in the end, rather than learning the entire subjects in the end. Okay, so it's very important, because medical education, you need to continuously condition your brain to become a doctor. For example, if a patient collapses, if you are a doctor, your body will automatically condition you to do a CPR. It is not that you will start thinking about, I have to do these many compressions, I have to give this mouth to mouth breathing. In that situation, you act. Just like you learn swimming once, that skill is there for lifetime. You learn cycling, that skill is there for lifetime. Medicine is also like that. So you really have to put yourself into it, heart, soul into, and brain into it, in order to achieve that degree.
So this program with Apollo MedSkills at Zarmed includes regular academics, and from year 1 we'll start teaching them either NEXT, USMLE or UKMLE. As per the choice, the student can choose from year 1 which pathway he wants. So that either if he wants to come back to India to do his practice here, become a registered doctor or pursue his masters, or he can choose any other country to go. But in simple, what Dr. Srinivas has pointed out is he has to be prepared from year 1 for getting certainty in the passing of the FMG NEXT exam or UKMLA or USMLE.
Okay, that's really nice, sir. Nice talking to you.
Thank
and
you.
I hope I'll advise all my beloved ones to join Zarmed University. Why? Because I missed the chance when I was doing my graduation. So definitely I'll suggest my sub-juniors or someone. Who is
Thank you so much for having us here, and any questions you can reach to our counselors in
Yeah,
our office, which is at Jubilee Hills in Hyderabad.
sure.
And we have the university website, and all the information is also available there. So the process of admission and everything is clearly written there, and in case of any questions they can reach our counselors.
Yeah.
Thank you so much for inviting us. Have a nice day.